All right, ladies and gentlemen, while Dr. Oji was giving his welcome remarks, someone walked in here. In fact, even while seated, you can actually even see him as he's sitting. That tells you how big he is. We are talking of no other person than the representative of the keynote speaker, Amina Mohammed. He is the UN Resident and Humanitarian Coordinator in Nigeria. Mohammed Malik Fall. Please, a round of applause for him. Sir, please kindly come up. Come up to the high chairs. Today we have high chairs. All right, let's celebrate him as he comes. You can see the height. You're welcome, sir. All right, we're moving on fast so that we can finish up. And we want to call for the introduction of the conference objectives. We have to perform this task. The representative of Dr. Binyere Ukire, Director Reproductive Health, Federal Ministry of Health. He's no other person than Dr. John Ovoroaye. He is the Director, Gashi. Please, a round of applause for Dr. John as he comes to tell us the conference objectives. Dr. John.
Thank you very much, James. Thank you. Your Excellency, the Deputy Speaker, Right Honorable Benjamin Kalu, the Coordinating Minister of Health, ably represented by the Permanent Secretary, Kashalom Daju, MNI, our Chairman, sir, all other distinguished guests, permit me to align with the already established protocol. For us that already have the agenda, if you have the agenda, please, you may just flip to page 10 of the agenda. The objectives are there. But I've been asked to make sure I speak to it for the sake of those of us that are here that don't have the agenda. So we can actually go through it together. Number one, to ideate on ways to reinforce the commitment of stakeholders, including government entities, civil society organizations, the private sector, and communities towards achieving national and global family planning goals. So you now know the reason why we should go through the objectives so that we know why we are here and why we are gathered. Number two, to facilitate discussions aimed at identifying and addressing barriers to the effective implementation of family planning policies and programs at the grassroots level. So we are here to facilitate that. Three, to share best practices, innovative approaches, and lessons learned to improve the quality, accessibility, and inclusivity of family planning services across Nigeria. Number four, to advocate for investment in healthcare infrastructure, workforce development, and supply chain management to ensure the sustainable delivery of family planning services nationwide. Number five, to discuss and prioritize efforts to reach marginalized populations, including adolescents, rural communities, and underserved regions, to ensure equitable access to family planning services and reduce disparities in reproductive health outcomes. Number seven, to amplify advocacy for increased funding and resource allocation towards family planning programs. I think with the caliber of people that are here, the dignitaries that are here, this number seven objective, advocacy for increased funding, is going to be something that we will be achieving at the end of this conference. Because the people that will actually put their voice to it, they are gathered here. Thank you, sir, the Honorable Speaker. Number 8, to explore and work with the National Assembly and other partners to make family planning a priority. Thank you very much. These are the objectives. Thank you.
A round of applause for him, please. Thank you very much, sir.